Okay, hi, it's Dr. Buford. We're just getting started on the right shoulder. Looking in from the back to the front, everything's magnified a bunch, like 30 or 40 times. That's a really pretty undersurface of the rotator cuff tendon there. That cord there, that's the biceps, and then we're going to look down at the biceps anchor. Maybe some sort of crochet hook or something. We'll see if this anchor is a little bit loose. That was one of the concerns. I think that's not that bad. Tendon looks pretty good to me. That's a normal amount of laxity. As we look inside the joint, the articular surfaces look great. That's the glenoid down below, the humeral head up above. This is the anterior shoulder. This anatomy looks great. That's the anterior band of the inferior glenohumeral ligament. That's the anterior band. The posterior band is over here. Basically right there. That's the posterior band right there. And the anterior band right there. And the middle glenohumeral ligament is going to be up here crossing the subscapularis tendon right at the tip of the crochet hook. So that's the middle glenohumeral ligament. Okay, so I'll pull this up there. So we're going to look a little bit closer at this biceps tendon and decide if we have to do anything. I don't think we do, but we're going to look a little bit closer here. Okay, so we're going to go ahead and release the biceps. We had a look at it, and it was a little bit more damaged than I was comfortable leaving. So we're just cutting right through that now. And there's our biceps tenodesis. Okay, and now we'll put in our shaver, just clean up the edges here for you. We're going to reattach this a little bit later, but at least now we know this biceps won't cause any more problems inside the joint. Okay, so we're in the subacromial space, which is up above the rotator cuff now. Before we were in the joint, and we got a chance to see the undersurface of the cuff. And so what we're seeing here, this is the posterior aspect of the cuff. And this posterior aspect, especially as I internally rotate, looks good. We get to the mid portion of the cuff and it starts to look a little bit frayed. Right in here, but nothing close to a complete tear. See right here, it's a little bit frayed. Right in here. But certainly not bad. And then if we go a little bit more anterior to the right, we're going to bump into the bicep sutures right there. And we know we've got to do a tenodesis. So I'm going to grab those sutures and get ready to do our tenodesis. I don't think we're going to have to do anything to the rotator cuff. So all in all, that's pretty good news. It'll be less to recover from. We are going to do a biceps tenodesis right about here. Okay, so we're all done here. We're taking one final look around. And again, the rotator cuff looks pretty good. As we pull back here, rotator cuff here all looks good. I'm going to rotate your shoulder. That's all rotator cuff, what you see rotating. A little bit of fraying there, but not too bad. And then way up here, that's the biceps tenodesis way in the front. So we're going to finish up here. I think the decompression, which you can see at the top of the screen, and the biceps tenodesis should do the trick. So good luck to you now. Bye-bye.